I'm Susannah Sirkin. I'm a longtime former director of policy at Physicians for Human Rights. I think that when human rights are violated, science and medicine cannot advance. And the most extreme violations of human rights that affect whole populations require and obligate the medical and scientific communities that are usually bound by their ethics and their oaths, which include making the world safe for human health and human life, and advancing culture and science and technology in a way that protects all people and their potentials as human beings, and basically protects the planet. All of those things are under threat. And unless the scientific and medical communities document what is happening, bring the evidence to bear, collect the data, and then make it public and support advocacy for change, I believe that we as a civilization and as humanity are doomed. This is going to be a period when anyone working in human rights needs to double down. We're seeing all around the world the emergence of autocracy, which means the suppression of human rights. And everywhere in the world and throughout history, scientists and doctors have been and must be at the forefront of the defense of human rights. So right now, for example, I think we need to be very careful about what would be considered regression. And when we're looking at the right to health, the Covenant on Social, Economic, and Cultural Rights, which includes the right to health, calls for the progressive realization of these rights, which means that you can't suddenly make it all better tomorrow. Not everybody's longevity is going to suddenly improve overnight. We're not going to end every infectious disease overnight. We're not going to give everybody 100% free healthcare overnight. But we are required to make progress. But when you go backwards, that's a human rights violation. It's understood in international law to be an actual violation. There have been enormous advances for women and girls around the world in the area of reproductive health, and they're based on rights that the global community recognizes. If we go backwards on that in this country and in other countries, that will also be an actual human rights violation, and the medical and scientific communities must speak out on that. So I think the same would be true, for example, in terms of access to care, including for migrants and immigrants. You can't suddenly say in a country where there is a risk of infectious disease that suddenly you're not going to provide services to a particular portion of the people who happen to be in your country, because that is scientifically understood to undermine health and undermine the health of everyone. So we're going to need people at the academies and the Human Rights Committee in particular to be very bold and courageous. And I believe that the leaders of the Human Rights Committee and the National Academies overall are up to this task. We're going to be counting on them.